Good morning. Bob Ravenscroft, the Vice President for Advancement. We're here for the Friday, May 1st media briefing. Welcome, Lori, filling in for Matt from the Journal-Star today. And I know our media alert this morning went out and said John Woodrich would be here. John had an appointment, non-COVID related, but that he could not be here and was unavoidable. So we have with us Lisa Vail, our Chief Nursing Officer. Not saying it just because Lisa's here. She's by far the best Chief Nursing Officer I've ever had the pleasure to work with. And as we've stood up our incident command, she's been the senior team lead that has been leading this tremendous team of people, keeping us prepared and ready to execute. Another, I think, interesting note is it was way back in February, the last week of February, the first Bryan person interviewed for COVID-19 was Lisa. And it was interesting to look back and see the things that were addressed then. It was basically all of the safety measures except for face coverings at that point that she was sharing with the public. So we're glad to have Lisa here. Going to mix it up just a tad. I'm going to start with our midnight census. We were at 354 at midnight. With Bryan Easy Visit, we have now had 11,689 people complete the screening questionnaire, resulting in 3,826 easy visits, and 1,800 of those individuals have used the COVID-19 promo code. So before I get to the daily stats, I'm going to do something a little bit different. The weather looks great this weekend and into next week. We're all caged in. Our state and our country are beginning to open back up. There are going to be parishioners going to churches in Lincoln, across southeast Nebraska as soon as this weekend. We know people want to get back to work and get back to some form of normalcy. We want to see our family and friends and do the things we used to. But I am requesting a favor of everyone viewing today, either through Facebook Live or the media. Keep yourself and your families safe. So I'm going to use an analogy because most of us like football and get football in this state. Our team right now is the underdog. We've prepared well, we've played well all first half, and it's against a really strong, menacing, and stealthy opponent. Well, they just scored, basically, and now we're pinned inside our 10-yard line with less than 2 minutes to go to halftime. And we don't want a bad punt, we certainly don't want a turnover, and our defense is going to have to be solid so we can preserve this lead we've worked so hard to get going into the second half. Heaven knows we are tired of daunting opponents in the second half around this part of the world. So what we're really asking of you today, both the public and the media, regardless of the loosening restrictions, meticulously wash your hands, cover your face, avoid the large crowds where people are congregating, and be cautious of who you interact with. We know that we don't know who has this, so I think everyone understands that at this point. And I'm sharing this because next week, aside from the weather, there's going to be temptations. We have Cinco de Mayo coming up. We have graduation parties, even though they're quite different. We have Mother's Day. So it is imperative that we try to cover and promote any organization, any individual that is safely setting their business back open for business, that is safely coming up with creative ideas for graduation or Cinco de Mayo parties, and highlight how people can do that safely. If you hear of those things, please share it. Maybe you'll give inspiration. And I'm asking you as individuals in the public and then certainly the media to try to double down on sharing the safety aspects and understand that there are growing exposures here. Again, I'm sharing this because this opponent is tough. We're inside our 10-yard line pinned up. And we know that with COVID-19, what we've learned so far is that about 75% of the people are walking around that have it. They don't know they have it, yet it is highly contagious. Of those that know they have it, we've told you most don't get sick, but 15% get really ill, and about 5% get critically ill. So I hope this analogy puts into context what we're going to share with you with our daily testing statistics. At Bryan, we have conducted 3,635 tests. We now have 399 positive results, 2,953 negative results, and 283 are pending. Of those pending, 251 are from our Bryan drive-through clinic, and only 17 are from the mobile clinic yesterday. So testing results continue to come in faster. To put this further into context, last Friday we had 2,355 tests conducted at Bryan with 127 positive results, or about 5% of them were coming back positive. Since last Friday, we have tested 1,280 with 279 positives, meaning about 22% of those now tested are coming back positive. That's the opponent we're facing going into the second half, as there seems to be some momentum for the opponent with both the increasing numbers, the spread, and at the same time we're loosening restrictions and everybody is so eager to get back out there. So stay safe, stay cautious, and protect yourself and your family. With that, Lisa's going to share a little bit about what's going on in Bryan and a little bit more about what's going on with mobile.
Good morning, everyone. Thank you, Bob. Lisa Vail, Vice President of Patient Care Services and Chief Nursing Officer. I'd like to start with just sharing with you the numbers of the patients that we currently have in-house. Currently, we have 15 patients that are hospitalized that have COVID-19. 6 of those patients are in the intensive care unit, and 5 of those 6 are on a ventilator. We have 5 patients in progressive care and 4 patients in general care. We also have 3 patients who have successfully recovered from COVID-19, meaning they've had 2 negative tests, but they are still in the hospital convalescing. And so we continue to care for those 3 individuals as well. Yesterday, our drive-through tested 149 individuals. There was no mobile clinic yesterday, and there is no definitive date for a location for the next mobile clinic. But we continue to work with the Lincoln Lancaster County Health Department, and we do anticipate that we will be out sometime next week with our mobile clinic as well. Tomorrow, Saturday, we will be having a secondary drive-through clinic in the morning at our location down at Life Point on South 27th Street. So we will be open from 9:30 to 11. And then again from 1:30 to 4. We do have the capabilities to test up to 160 individuals at each of those drive-through clinics should the need arise and individuals qualify for the testing. So we continue to do very aggressive testing in the community for those patients who meet the criteria, because we are really trying to find out how prevalent this is and to reduce the spread of the disease throughout the community. One of the other things that is currently being worked on at Bryan, as you know, we are opening up a little bit with our elective surgeries come Monday. We've got plans in place. We are following all of the same safety protocols that we have done in the past. We are doing active screening for those individuals when they walk in the door from a symptom perspective, as well as checking temperatures. They will have that same assessment done when they arrive at the department where they will have their procedure. We are still not allowing visitors at this time, and we are trying to limit this to individuals who are having a same-day procedure or who may need to stay one single night in the hospital before they go home the next day. So that is happening on Monday, and we are ready for that and looking forward to seeing some of those individuals who have had to delay their care. One of the other things I just wanted to share, it's probably not really a COVID topic, but today is May 1st. Many of you may think of it as May Day. I think of it as the beginning day of the month of May, which is this year the month of the nurse. The World Health Organization back in late 2019 decided to celebrate the 2020 Nurses Week festivity with a full month-long celebration in honor of the 200th birthday of Florence Nightingale. So we are kicking off some of those festivities here at Bryan. Next week, actually May 6th through the 12th, is the official Nurses Week, ending on the 12th, which is Florence's birthday. But this year, what they focused on the themes related to nursing could not be more timely than they are right now from this global pandemic preparedness. They talk about the role of nurses and what nurses do to lead, to innovate, and to excel. And although my entire team, every single person on the care team, environmental services, security, nursing, physicians, pharmacy, everyone is doing an exemplary job, and I'm so proud of them. Being a nurse, I got to hang with my peeps, I'll say, and I'm just really excited and honored to be a nurse in this organization and to work with such wonderful nurses. So if you know a nurse, if you love a nurse, send them a card, wish them Happy Nurses Month or Nurses Week, and thank them for what they do. Thank you.